Hello, everyone. My name is Marty Guthmiller, CEO at Orange City Area Health System, bringing you another COVID-19 community briefing. Today is Monday, August 16, 2021. As has become our practice over the last year and a half, I'm going to start off with a few statistics to kind of give a little bit of the environment that we find ourselves today. First of all, Iowa. The 14-day average in Iowa is 7.6%. That is up a little bit from previous weeks at 7.1 and prior to that at 5.7. So Iowa's up a little bit 14-day. On the 7-day, Iowa's still at 7.6%. We're at 7.6 a week ago and 6.6 2 weeks ago. So Sioux County, a little bit better numbers. Sioux County 14-day was 4.2% this morning. A week ago was 6.9, 2 weeks prior, 5.7. The 7-day average positivity rate in Sioux County is 2.9, significantly down from the previous week of 6.3, and significantly down from that 2 weeks ago at 10.2. So Sioux County 7-day, 2.9%. Of that, 92% of the positive rates are below age 70. There was a bit of a hiccup today on the coronavirus.iowa.gov website, and it didn't give me a great breakdown of the age categories, but 8% was 70 and above. And it said 12% was between 18 and 29, but that doesn't really help you a lot. So 93% below age 70, that is good from the standpoint that our more elderly are the most vulnerable. It also makes sense that our elderly have been the most vaccinated. And so again, vaccination does not make you bulletproof, but it does provide many other benefits. So I want to keep going with Region 3. Region 3 has 35 hospitalizations, and that's the 20-county region in Northwest Iowa. That compares to 33 a week ago and 29 a week before that. So pretty steady, slight increase in the number of hospitalizations. 12 in the ICU in Region 3, 6 of those are on ventilators. So obviously still a very serious situation for some folks. The number of deaths in Sioux County, while going up across the state, or while continuing across the state, I should say, have remained unchanged in Sioux County for several months. I want to talk a little bit about some of the information you might be hearing on TV with hospitals being full or near capacity or the system being stretched. Something similar to this might be an analogy of restaurants. While there might be open tables, there are not staff to wait on those tables. Sometimes in the hospital situation, there are staffed beds and licensed beds. Sometimes those numbers aren't the same, meaning that we can't get staff to work them. And that is becoming more and more of a common problem in healthcare today, and the reliance on temp staff to fill the need. In terms of a couple other area things, give you a little bit more example of that. Omaha over the weekend, my understanding is that this was at the Med Center, had 80 people, 80, in a holding pattern waiting for placement somewhere. So the hospital was at capacity. In Des Moines, and I don't have the specific reference to the hospital, that's 60 people in a holding pattern in the ER waiting for hospital placement. So while the hospital capacity is being stretched, it is not being stretched by COVID. It's being stretched by a lot of other things that are out there. Sometimes the downstream effect of delayed health maintenance items, advanced cancers, advanced cardiac issues, those kinds of things. There's no question that our hospitals are not full, but reaching capacity, that the system is being stretched, but not because of COVID. One of the things that I would like to talk a little bit about then is our response here at Orange City Area Health System. Right now it's steady. We're going to be maintaining all of the things that we have in place today. We're not going to be further restricting them, but we're also not going to be loosening them at this point. So you'll continue to be screened when you come to our clinic. You'll continue to be screened in the ER. You'll continue to be screened as you go into a patient's room. We'll be wearing masks in those patient-provider relationships. And so that's where we are. We're not going to change our position at the moment. One of those positions is in the mandate for vaccinations. Some of you may know that many health systems have mandated vaccinations for COVID for their employees. Sanford is one of those organizations. So is Mercy One. So is Unity Point. Avera at this point, that my understanding, has not mandated a vaccine requirement for their staff. So some people have asked, since we're affiliated with the Sanford system, is Orange City going to mandate vaccine for employee? We are not. That doesn't mean that we're in disagreement with what Sanford is doing or what Unity Point is doing. We're not. We understand that position. But at this point, based on what we're experiencing and what we know here in this part of Iowa, in this part of the country, we do not anticipate requiring our employees to be vaccinated. There are, again, arguments on both sides of this fence, but that's where we're coming down on the issue right now. So steady as she goes. We're not going to be changing any of our policies right now. We are not going to be mandating vaccinating all of our employees. And again, a reminder, our nursing home is a little bit different in terms of it has a different set of rules and regulations, and that is being followed very closely, and we're adhering to that. We continue to lift up our nursing home folks, both staff and residents, as it's hard on them, but better than it was certainly a year ago. Wanted to talk a little bit about testing. We get a lot of questions on testing. That's changed since Test Iowa has closed now. But here are several different options for you to consider if you need to or want to. If you have symptoms and you have to be symptomatic, you can get a clinic appointment and receive a COVID test in our clinic system. But again, you need to be showing some symptoms for that. Regarding school and travel, a lot of questions regarding this. Oftentimes there are PCR tests that are required. In the old days, that required a rather unpleasant nasal swab. There are PCR tests now that require saliva, and we have those available. Those kits can be picked up either at our South ER entrance window or in our North entrance, our front entrance, from somebody at the reception desk there. So they are saliva tests. They are free. You can pick them up. You are responsible then for sending them in via UPS, and the results are promised by the state hygienic lab within 24 to 72 hours. Most cases, and you want to check to make sure, but that these do fulfill travel requirements. They are a PCR test, but they're totally outside of our control, other than we are making them available and you can pick them up for your use. There is also, if none of those fit or you don't have 24 to 72 hours to get the results, we do have antigen tests available. They are the rapid tests. They'll be the results available in 10 to 15 minutes. Those would be available through occupational health. Those will carry a $35 charge with them. Appointments can be made by simply calling 737-5273, and the occupational health folks will line you up with a rapid test or an antigen test. Again, 737-5273. Getting back to the treatment of these folks with COVID today, we continue to have the full arsenal of treatments available to us. On different occasions, we use different situations and different medication, different tools from that arsenal, including at times ivermectin, hydroxychloroquine. We're certainly well aware of those drugs. They are not for everybody. They are not to be universally applied to everyone, but in some cases they do make sense. And we have administered those drugs in the past when it makes sense. So those are issues that you work out with your provider directly. While we're not going to mandate vaccinations for our employees, we do encourage all of our employees to be vaccinated, just as we encourage all of you to be vaccinated. We do believe, and we're not alone in this, that is the best way out of this latest surge and ultimately the pandemic, is to submit to the vaccinations. And there's certainly less risk to the vaccination than there is from the disease. There's no question about that. If you are not vaccinated, you will likely get COVID at some point. That's simply the fact. Now, that's not meant to be scare tactic, and because most people certainly have minor consequences from the virus, but you can avoid that to a large degree, in the high 90%, by simply getting vaccinated and helping yourself out. Now, one of the things that I just want to reiterate, and this is the broken record piece, and that is keeping your engine tuned, and keeping yourself as physically fit as possible. And I don't mean going to the gym every day and, lifting a ton of weights and all that kind of stuff. I mean proper diet. It's a great time of year in Iowa to eat fresh produce, take advantage of that. Have a diet that's a good diet. Exercise. By exercising, we mean a brisk walk frequently, 3 to 5 times a week. Just get out and exercise. That's a good thing. Weight loss is kind of a combination of good diet and exercise, but very important. And so we ask that you keep that engine tuned, because ultimately that is the best way for our bodies to fight off not only the COVID virus, but every virus. Health maintenance, please make sure that you continue to do those things, your colonoscopies, your mammographies, all those kinds of things. Make sure that they're all being taken care of and you adhere to this. Again, part of the capacity that we're experiencing in healthcare today is, in some cases, those things have caught up with some people, and that's not good. It's preventable. So please make sure your health maintenance items are being taken care of. Finally, don't forget about the mental health side of this. We all have COVID fatigue. It's manifesting itself in many different forms throughout our society, I believe. But maybe, if you find watching the national news a little depressing, don't watch so much of it. Maybe turn off the channel a few nights, maybe turn them off for a week or 2 or 3. You want to be informed, but if it's causing you anxiety and you just don't like hearing that all the time, turn it off, turn channels, and go outside and walk, particularly during this time of the year. So that's where we are today. We appreciate the trust and confidence placed in Orange City Area Health System and our providers. We do greatly appreciate that. We thank you for taking the time to listen to this video. We encourage you to get vaccinated, and we encourage you to let us know if we can help at all in this journey. Thank you so much, and be well.